Good evening, and welcome to Wellness Watch, sponsored by the African American Wellness Project and co-sponsored by BlackDoctor.org. I am your weekly co-host, known as Ellis Dean, a project manager with BlackDoctor.org. And let me say this, happy Cinco de Mayo. So want to all of you all that are not out celebrating right now or are preparing to go out and celebrate, we thank you for joining us this evening. So just want to make sure that you let us know where you're watching from in the comment section. We like to know where people are watching us from all over the nation. We also would like for you to, if you get some information or if you find something that you like here, like it, share it, tell a friend that we're here every Wednesday evening at 9 p.m. Eastern, 6 p.m. Pacific time. So we have a wonderful show today. We have Dr. Langford. He is your urologist that is really going to talk about everything from UTIs to all across everything that's part of our urinary tract, some things that you might not even know that are part of your urinary tract. So we're going to talk about that with Dr. Langford tonight. But always, we cannot start our show without the man of the hour, the man of the day. He keeps tired of me calling him the man of the hour. He is the man of the day, the man of the week, the man of the month, also known as Dr. Michael LeNoir. How are you doing, Dr. LeNoir?
Oh, I'm good, man. I'm celebrating Cinco de Mayo in a number of ways. I got some tequila out there, but I haven't used it yet. But certainly going to celebrate. You know, this is also World Asthma Day, and people are celebrating that. But it's no cause for celebration in the African American community. African American children still dying 3 times more often than other children with asthma. African American women have the highest mortality rates from asthma. And so we need to do everything we can to reverse that before we can take time to celebrate. So that I do think it's important to acknowledge it, the fact that 23 million Americans have asthma. But I want Black Americans to understand we're not in the group standing up cheering and celebrating with balloons and things until some of these statistics come down. I also, with the COVID issue, a lot of the vaccination situations have slowed down. Some places have too much and too many vaccinations for the people that they have. And so we don't want this to slow down for African Americans. And we're still way behind other people. And it's pretty clear that this vaccine works. It's pretty clear that it's pretty safe. I don't know what you're waiting for, Black people, for not getting vaccinated. So we are really concerned about our people over the age of 65. But it turns out that people over the age of 65 are getting vaccinated more than younger people. And so I want those of us who are older than that to talk to our children, talk to our grandchildren, and sometimes they listen to us. Not often, but sometimes. It doesn't look like we're going to reach herd immunity, which is 70% of the population, but it certainly looks like from what I see, when I went to San Diego today, man, it was like last weekend, it was like no pandemic ever occurred. I'm seeing the traffic is back. I'm getting kind of upset. I'm used to coming home in a leisurely fashion, but now there's so many people out there, it looks like it's pretty much back to normal. But it can get back to normal as long as we're vaccinated. And Black people, let's not far too far behind, because this is really life-saving. And already colleges and universities are saying you can't go back unless you're vaccinated. They're about to release the ability of people 12 to 16 to get a vaccine, and that's a very good thing. So our schools should be able to open safely. Pretty soon it'll be down to 2 years of age, and I think we can celebrate that. I got this thing off the internet of 10 reasons why young people should be vaccinated. There was a time I could memorize this in maybe 5 or 10 minutes, but those days are long gone now. But I do want to mention a few things why young people should be vaccinated. First of all, COVID-19 doesn't have to kill you to wreck your life. We know that so many people have side effects from after they have the vaccine, neurologic, cardiac, and other. Getting vaccinated will help the economy. I don't think there's any question about that. And vaccines can save people a lot of money because it could be a very expensive disease if you have it, even if you have insurance. Getting vaccination can up your dating game. I'm long out of that mix, but I don't mean holding back information for people who may need that. I mean, a lot of times you may be looking good, have on your best suit and everything, but when the question comes, have you been vaccinated? And you can't answer that question. Who knows what that might prevent you from meeting, who that might prevent you from meeting, who that might prevent you from dating. And I'm not going much beyond that. Young people or their friends may be at higher risk than they think, because many of the new cases now are in people who are between the age in the 40s, 50s, and 60s, as opposed to before. And these new strains are out there. I mean, if you look at India, what is that, 1.8 billion people?
Yeah.
Many of them infected. One of my friends said his whole village was infected. You know the variants are going to be harder, tougher, more difficult to deal with, and so you need to be concerned about that. So those are the few reasons why young people should get vaccinated. And so finally, we'll talk a little bit about sleep. I don't know, Alice, you're probably at that age where just getting in bed means you're gone. But for those of us a little bit older, we're having a little bit of trouble staying asleep or going to sleep. But it does appear that you've got to get 6 to 7 hours some kind of way. Now, what I have found, a couple of things. These are the LeNoir tips. They're not on Facebook. They're not in any of the magazines you might read.
Wait. Before you get the LeNoir tip,
LeNoir tip.
Get out a pencil and a piece of paper. You are about to get a LeNoir tip. So write this down right now. Write this down.
Too often. But YouTube has these little things that you can put on your TV with the storm coming, with thunder, a little the fall, the water rolling in, and they do help somewhat. But what really helps me is books on tape. I've set the book on tape for 30 minutes before it turns on. I haven't made 10 minutes yet. I mean, I still don't. It's taken me about a year to get through every book on tape. So that's another thing that may distract you into falling asleep. But I think it is clear for you to be most effective, you need at least 6 to 7 hours worth of sleep. And finally, something we've talked about before, because of the pandemic, then we're not getting to the doctor for our regular checkups and our regular screening. It's been demonstrated that people who are not going to the doctor are missing prostate cancer screens, breast cancer screens, colon cancer screens, and even skin cancer screens with melanoma. And African Americans are suffering the most from that piece. So don't forget to keep up with your screens, keep up with your regular physicals. Don't let the pandemic slow you down and put you into another process.
If I could add one thing, Dr. LeNoir, I was reading the other day that there's been some discoveries about the actual coronavirus being more of a vascular illness, more so than it was. At first, everybody thought it was respiratory, but they're saying now that it's more of a vascular illness, and so that can affect other areas of the body and have a more long-term effect. And so when we're talking about people that are concerned about the vaccine and what that could do to the body, I think there should be more concern about the virus and what the virus can do, even if you survive. So I think people are more focusing on the survival and saying, well, I can live, but you don't know what the long-term effects of having that vascular disruption to that virus in your body could do to you long term. It could shorten your lifespan. It could cause other complications. It could exacerbate other issues that you might have, medical issues that you may have. And so we have to really talk. I don't think we're talking enough about the long-term effects of even surviving from COVID because of what that virus could potentially do to your body now and in the future.
Yeah, no question. When you have a vasculitis, that means it affects vessels all over the body and can disrupt blood flow to those to various organ systems, and that can be some of the nitis of the myocarditis we're seeing, the neuritis we're seeing, mental impairment we're seeing. So consequently, this virus is no joke, and so consequently, vaccination has certainly made a big difference. It's safe, it seems to be, it's effective, and so I think you really have to go back, if you're not getting vaccinated, to understand what the implications are, both social, economic, and physical, of not getting vaccines.
And quick shout out there. We got some people watching from my hometown of Jacksonville, Florida. So I want to give them a shout out. Shout out to people from Jacksonville, Florida, hometown. So I had to take a little personal Cinco de Mayo. So we're gonna have a little fun today. We're gonna learn though. We're gonna give you some. Are we ready to bring on our guests?
We're ready. Tonight we're going to be talking about urologic disease with Dr. Langford. Dr. Langford is a urologist trained at Meharry Medical College and most of his subsequent training in New York. He's an expert and some of the latest techniques in dealing with urologic problems. And there's a number of things that we want to talk about, focusing initially on urinary tract infections, but maybe getting to some of the other issues that urologists do. If you want to join us, of course, go in our chat room. We'll stop what we're doing to answer your questions, regardless of what they are, the nature of the questions. And as long as they're about urologic disease, I think we'll be willing to take them primarily away from the conversation. This program is always for you to ask your questions and get information that you need. Dr. Langford, welcome to our program. Now, I told people, I know you thought you were going home from work, but I told you that you're just starting your work here. We want people to call you, ask you questions, challenge your notions, and get information from you as we go along, and we'll keep track of that. So welcome to our program. Tell us what got you interested in the field of urology.
You're on mute, Dr. Langford.
You're muted.
Sorry about that. Thank you for having me, Dr. LeNoir. It's a pleasure to be here. Let me start by saying it's an honor to share with you in this program tonight and help to educate people about urologic diseases. I believe your question was what interested me in urology. That's a common question. Usually it's given to me by patients while I'm right before I'm going to do a procedure on them that puts them in a precarious situation. They look back at me and say, man, what made you decide to do urology? And I got to say that, I love the field. It gave me the opportunity to do surgery, which is something that I love, but also be on the cutting edge of technology. Urology is one of the fields that uses technology to treat disease, diagnose disease, and study disease. So I would say that it's the technology and the ability to do surgery.
Now, we asked you to give us a list of questions and topics that you're interested in, and you chose urinary tract infections. I was a bit surprised by that. Why is that so important in urology?
Well, urinary tract infections are pervasive. They're sort of the thing that plagues everybody, starting when you're young, all the way to you're very old. And so I thought that was a great topic to get people engaged and to sort of introduce urology as something that's very useful to everyone, something that we all have to deal with at some point. And people tend to have a lot of questions when they get these frequent urinary tract infections, both men and women.
So I was surprised. I was surprised that because when I always heard about UTIs, urinary tract infections, I always thought about women because, like, my wife would have them, my sisters would have them, and so I never even thought about men having UTIs. And so, how does that express, and how often is it happen in men?
Yeah, no, that's a good question. I think start off by saying first, an infection in the urinary tract. The urinary tract consists of the urethra, which is the tube that we pee from. You go back to the bladder, which is the storage vessel for urine in your body. And you go up, there's tubes that connect the kidneys to the bladder, those are the ureters, and then the kidneys themselves. And so a urinary tract infection can be an infection encompassing any of those structures in the body. Okay. Now, one of the things that's important is to look at the difference or the dichotomy between men and women, because I think that's really important. Women more commonly have urinary tract infections. However, what is uncommon? What is a uncommon amount of urinary tract infections to have in 1 year? We usually look over 12 months, is greater than 2 for a woman.
Oh, wow.
Versus a man, 1 or more is uncommon.
Okay.
And when you say uncommon, when we say uncommon, or when I'm referring to it being uncommon, meaning that if you are having more than 2 infections in 1 year, if you're a woman, or 1 infection in 1 year, or singular infection as a man, then this must be worked up. We must look into what the cause of your urinary tract infection is.
And if you look at causes, what are some of the common causes for, say, a man to have a urinary tract infection, and why do women have more often?
So, the most common cause for a urinary tract infection is dehydration. And sometimes the stasis of urine during dehydration can fester. I always tell people, when you look at urine, think of it like a lake or a river. A river, when things are moving, less risk of infection. But a lake or a pond, when things are stagnant, more risk of infection. Now, if you place on top of the fact of the movement of the urine, that has a lot to do with what you drink and your hydration status. But if you superimpose diabetes, high blood pressure, and all these systemic diseases that put us at greater risk for infection, then you see why certain populations have higher urinary tract infection rates than others. Now, one of the other things, urinary symptoms, or men with large prostates that can't urinate well, that's another risk factor for a urinary tract infection, the stasis of urine not moving easily from the bladder out through the urethra. And so all those are risk factors that sort of put people at risk for getting urinary tract infections. But I would say the most common denominator among all the times when people get urinary tract infections is stasis of urine or dehydration.
Okay. So one of the things that people don't recognize is urinary tract infections can be in various parts of the urinary tract. So when they think about urology, they're usually thinking about genital organs, or they're thinking about the bladder. But certainly urinary tract infections can creep up the urethra into the kidney, and that becomes a very dangerous process.
Yes, that's right, Dr. LeNoir. There's a lot of different terms, and I think a lot of times people say cystitis or urethritis. These are terms that your doctor may use, and they're talking about inflammation in the urethra or inflammation in the bladder. But those can also be local infections in the urethra and local infections in the bladder. But when you get a local infection in the kidney, this is dangerous. The reason why is the blood flow to the kidney is very, very, very robust. And bacteria can easily transmit into the blood from the kidneys. And when the bacteria transmits into the blood, this causes a systemic infection. And that's why
it means all over the body.
It means all over the body. That means you feel like you got COVID, except it's a urinary tract infection.
Okay, so is the wives' tale of drinking cranberry juice, is that real? Does that work? Does that help with UTIs? Does that help curb or stem UTIs? Or is that just an old wives' tale where you drink some cranberry juice and you're okay?
So from, a lot of research has been done into cranberry juice and things of that nature. When you do a head-to-head trial looking at cranberry juice versus a placebo, there has been no benefit to preventing the number of urinary tract infections per year when you compare that with a placebo, or when you compare that with nothing at all. However, one of the things, and I think that this is critical, is with your cranberry juice and other, some people even talk about drinking beer or just drinking more water. These are fluids that increase your hydration, that turn the pond into a river. And so by default, a lot of these things do help prevent urinary tract infections. Now, that being said, cranberry juice is still a critical thing that we use. There are even cranberry, there's popular advertisements where people use for cranberry juice because more of the historically what they've meant to urinary tract infections. However, if you told me that you got better because you drank cranberry juice, I'd be happy, but I wouldn't say that it was the cranberry juice. It was probably the fluids.
Well, don't you tell my grandmother that. My grandmother swore by cranberry juice, and she's been right. She lived to be 95. So I don't know. I trust you, but don't tell my grandmother.
Well, I always found myself doing that. I would if I've been out, partying a little too much, drinking some dehydrating type beverages that many people drink. one of the things I would do is the next morning is I would get a glass of cranberry juice along with water too, as a way to rehydrate. Just so, my mother would always say that that would be one of the things, like drink a glass of cranberry juice to help your body flow, and then drink a lot of water. So that was just kind of one of the things I did, and I think it does have that effect in your mind, and you think it works. If it works in your mind, then it might work on your body.
And I'm not gonna let you talk about his mother. We've got Dr. DeWood. Am I saying that right? DeWood, Langford?
Dawood.
Langford.
Yep.
He's a urologist. We got a couple of questions for you, Dr. Langford. So let's take a look at those. One of those is, water pills useful? But what about constant urinating? Is a water pill useful? But what about the constant urinating that you get with water pills? Does that have an impact?
Yeah, well, here's the thing. When you're constantly urinating, that's a good thing. The water pill, Lasix, it helps to bring urine into the urinary system. It brings water into the urinary system. So it increases the flow within the urinary system. So it should, by default, help prevent urinary tract infections. However, I would not use that as a solution or as a treatment for urinary tract infections. But it can help you move your urine. But there's a flip side to that. The Lasix will make you have to urinate. Sometimes having to get up to urinate in the middle of the night can be annoying. Or if you had to urinate every 30 minutes when you're sitting on the couch trying to watch the best movie, it can be annoying. So I think that I would not use Lasix to treat or to help a urinary tract infection.
We got another question about older women. Why do older women get more urinary tract infections?
Yeah, good question. So as women age, they lose the hormone estrogen. Estrogen causes the mucosa of the vagina and the urethra. The urethra and the vagina are very intimately connected, right? The urethra, the top part of the vagina, becomes part of the urethra. And this area, when it's well hydrated, due to the hormones, estrogen, it is less likely to be infected. When it gets less hydrated, becomes dry, becomes atrophic, this is more likely to be infected. And this is one of the reasons why older women get more urinary tract infections. Another reason is childbirth. The more children that you may have, this is more trauma to the birth canal, trauma to the vagina. This trauma to the vagina can also cause mechanical disruption of the urethra and the urogenital diaphragm. That is the collection of muscles and things that help keep the vagina in a good place. This can also predispose elderly women to urinary tract infection.
Here's a question that's a little bit off the topic, but of urinary tract infection. But does one get kidney stones, and how do you treat those?
So when we talk about urinary tract infections, if you were to come in to the office, and if you're a woman, and if you say, hey, Dr. Langford, I had more than 2 urinary tract infections in 1 year, okay? We would check the culture. We would make sure that you have a urine culture that shows a significant infection, okay? That's more than 100,000 colony-forming units, which is maybe a little bit too much information for, but when we verified that you had a urinary tract infection, then we start to talk about causes. One of the causes of recurrent urinary tract infections is urinary stones. Urinary stones in the urinary system, and that system that I talked about, from the tip of your urethra, if you're, all the way up to your kidney, if there's a stone in that area and it's stagnant, usually stones form due to stagnant urine, then that can hold on to bacteria. Bacteria cling on to it. It's a nidus for infection. This nidus for infection can cause recurrent infections. We treat it with antibiotics, and then the infection comes back, and that's because that stone is there.
And they say the urinary stones, one of the most painful things an individual can get. So that it's something that you really don't want to have. We got a couple of other questions. one having to do with frequency, urinary frequency. And the other thing is burning. Are those good signs of urinary tract infection? Because whenever there's burning, you start to worry, you know what I'm saying.
You start worrying about other three letters, not UTIs. You start worrying about STDs.
Then I didn't say that.
You're right.
I didn't say that.
I said
all I said was, what about burning? Is that a good sign of urinary tract infection?
Well, I do, Dr. LeNoir and Mr. Dean, I do have the pleasure, or I wouldn't say it's the pleasure, but I do have the responsibility to talk to men during that uncomfortable time when they think they may have a sexually transmitted infection, and we have to deal with those, and they're very similar in the way that they present. Obviously, the sexually transmitted infections sort of talk about a certain set of bacteria and viruses, whereas the urinary tract infections are another set of bacteria and viruses, right? Mm-hmm. They both infect the same areas, but one is specifically associated with sexual encounters more than not. However, some of those sexually transmitted infections could also be a benign encounter from a shaking of a hand or wearing the same underwear as someone else. But to answer your question, pain and burning, that is a good symptom of a urinary tract infection, but it may not mean a urinary tract infection. And this is one of the problems that we have as clinicians, is when a person comes to an office and they say, hey, I've had burning. Give me some antibiotics, doctor. I have a urinary tract infection. Well, first we have to verify and validate that there's actually an infection there. Right. Do you have a sexually transmitted infection that we can verify and validate via a test? Or do you have a urinary tract infection that we can verify and validate through a urine culture? Once we've verified and validated those things, then we can treat them. But if you don't, and these are just symptoms, symptoms can be caused by something else. Symptoms can be caused by mechanical disruption of the urethra. It can be caused by chemical irritation of the urethra and other areas in the urinary tract. And it's sometimes with people who have recurrent urinary tract infections, sometimes they may not even have had these recurrent infections, but more recurrent symptoms.
All right, we're at the African American Wellness Watch, sponsored by the blackdoctor.org and the African American Wellness Project. Our special guest, Dr. DeWood Langford. We're talking about urinary tract infections, but we're available for your questions on the urinary tract and your contributions to the discussion. My grandma's not here, but I'll stand up for them.
So I got a question here. There's another question here in the comments. Is there an ideal color or pH range of urine?
You know, so when you look at a urine dipstick, there's a urine dipstick study, and what I believe the questioner is referring to the urine dipstick. A urine dipstick has multiple factors in it. There's the pH, there's bilirubin, there's nitrites, there's leukocytes, and there's an ideal range for each of them. So, and that range can be in a certain range. But more importantly, I would say, instead of looking for the ideal range for your pH in your urine, I think it's more importantly, you have to ask yourself, what are you trying to achieve with your urine? Do you have urinary stones and you want to maintain a basic urine? Because sometimes I may go outside the ideal range with the pH if someone has urinary stones. Do you have frequent urinary tract infections? Then it may be something different. So I think more importantly, the question is what are you trying to do? Are you trying to prevent something through these monitoring of the urine dipsticks, or are you trying to diagnose something? Maybe you think you may have kidney problems. Kidney problems, there's a constellation of different things, not just the pH. So I wouldn't say there is an ideal range, but I would go away from naming a number because that may be wrong for you.
Well, but some people talk about urine, how the urine smells. Like they say, my urine is strong, smells strong today. You know,
right.
Is that it? Can that be an indication? Can smell be an indication or an indicator of urinary tract infections?
Yes, it can. Quite often do I hear, I have a foul odor to my urine. And, foul odor is one of our primordial instincts. Things that smell foul usually are infected, but not always, not always. And that's why it necessitates that the urine be sent for a culture. The culture is when your doctor takes the urine and they get grown under different media, different food. The urine gets grown. They plate it and it grows. And if the bacteria grows, then they figure out what antibiotics the bacteria is susceptible to. If you plate someone's foul odoring urine and nothing grows, then there was no infection. And that happens commonly.
We still have a couple of questions around urinary stones. One of them is, can urinary stones be removed? I mean, this is something that I think that Marissa wants to know. Can you remove urinary stones?
Yeah, of course. Urinary stones definitely can be removed. A urinary stone is a stone in the urinary tract, and usually, if it's small enough, it can pass. It can pass through. If it's too large, it can get stuck. And when it's stuck, it needs to be removed. There's a few ways that we're able to remove stones. Some involve fracturing the stone, breaking it up into little pieces. Others involve going in via little cameras and grabbing the stone. But if the stone does not pass on its own, it should be removed.
So I got a quick question, and this is from my days as a youth football coach, and we would have the kids. We would tell them to drink water until their pee was clear, because we wanted them to be hydrated. Is that a good thing? Are we overdoing it, or is that?
No, that's great.
Okay, all right. So that was one of the things we would always say. Look, if your pee still has color in it, you don't have enough water in your system. You need to drink it till your pee is clear. And the kids would understand, and that was something that they could recognize on their own. Okay, so that we weren't telling them to damage themselves. I was just wondering.
No, you were hydrating those kids.
Okay, there's a couple questions. One question is from Denise LeNoir. She wants to know, are there new drugs for women who can't hold urine?
Yeah, so when we talk about infections, we leave that on one side. Then we talk about urinary symptoms without infections. And some of the urinary symptoms without infections can be frequency of urination or urgency of urination. You feel like you got the urge to urinate. That's really popular among men because of the prostate. I got this urge to urinate, but when I go, it's not much. Right. So that's on one side. And then for women, there's the frequency of urination. They can't sit through their church proceedings. They got to go, get up and go. It disrupts some activity. And there are plenty of medications. The medications that we used to use for overactive bladder or frequency of urination were, there was a lot of medications, but they acted via a certain way that sometimes could make people confused. Can make you dry mouth, dry eyes. This was some of the side effects of some of the older medications. But now we have newer medications that don't cause as much dry mouth and dry eyes, and they don't cause as much cognitive or brain issues. So there are new medications, and there's even there's brand new medications actually that just recently got cleared by the FDA within the last year.
Oh wow!
Dr. Langford is our guest. Urinary tract problems and urinary tract infections is our topic. If you want to join us, go in the chat room and ask a question. We'll try to fire it right over to him. One of the things we don't want to leave this topic without talking about the treatment and those things that you can do to prevent the development of urinary tract infections.
Yeah, I think that's critical. I think usually I see the patients that come to me, they've come after they've had multiple urinary tract infections. They come to me after they've had multiple antibiotics and nothing is working. And one of the things I look at is prevention. And for a woman, we discuss a number of topics. And for men, we discuss a number of topics. And so I'll start with women first. With women, one of the major causes of urinary tract infections, or one of the major risk factors, is chronic constipation. I always ask about the constipation, and I always recommend that there'll be a stool softener, or I recommend that sometimes we have to change the way we live. We have to change the food that we eat. If you know that pasta makes you constipated, but you love pasta every Wednesday and Tuesday night, this is something that needs to change.
Right.
Also, urinary stones and things of that nature can cause recurrent urinary tract infections. So we do a workup to make sure we diagnose other causes. Obstructions in the urine, any blockage to the urine flow can be a risk factor for urinary tract infection. I always tell people to take probiotics. I think probiotics are underused. We live in a microbiome. We live in a world full of different bacteria. Many of these bacteria help us survive. They line the tracts of our lungs, they line the tracts of our mouths, they line the tracts of our entire body, and they help us survive. They help us deal with the more aggressive bacteria that could hurt us. And sometimes when we take antibiotics, we kill all the good and all the bad bacteria. So I make sure that the patient is continuously revitalizing their body with the good bacteria. And then there's a couple of other tricks of the trade. There's something called D-mannose. It's a sugar that feeds good bacteria. I sometimes prescribe that as an adjunct. And then the most important part, and that I leave for last, I recommend that everybody, and that means everybody, drink at least 2 liters or 2.5 liters of water a day. If you can get 2 liters, I say that's good, but 2.5 is really where you should be at.
Now, what techniques do you use to make the diagnosis?
We didn't talk about men, by the way, but
oh, I'm sorry. Well, roll on. I'm sorry. Excuse me.
No. Just all of those would fit for men. Same thing, except I would add for women, and this was the last point, is atrophic vaginitis. Estrogen, the loss of estrogen, or the decrease in estrogen levels causes the vagina to atrophy. And so sometimes we prescribe estrogen cream topically to the vagina. It's introduced in a syringe fashion, and that can help revitalize the vaginal tissue and prevent infection of the urethra. But it's contraindicated, or it's something that shouldn't be given to women if they have a history of breast cancer, estrogen positive breast cancer, and uterine cancer, which is hormone sensitive or estrogen hormone sensitive.
At some point, though, you have to do some diagnostic tests, and one of the tests that you do is cystoscopy. Tell us a little bit about that technique. And one of our questions is, can you do that without anesthesia?
Yeah, so normally all cystoscopies are done, I would say out of 100, 99% of them are done without anesthesia. You know, it was really tough back in the day. The instruments that they used were a little bit larger and cumbersome, but now I can safely say that most people can tolerate the cystoscopy generally well. And a cystoscopy is where we take a camera and we look through the urinary tract. We take a camera and we look into the tube of the penis and into the bladder. And that's normally...
That doesn't hurt much?
It's just, there's a discomfort.
You're not convincing me right now, Doc. I'm just saying.
It's a tough notion, I tell you. And I tell people don't even look at the camera, because it's just going to give you anxiety, you know. But you know, there's a numbing that we do prior to the procedure, and it really helps us because, as we talked about before, there are symptoms and then there's actual infection. And if we can discern or understand diagnostically if the symptoms due to maybe a narrowing in one of the tubes, sometimes the tube that we pee through can be narrowed. It can be narrowed because of a previous infection or a trauma. And so if we can see that with the scope, the narrowing of the tube, if we could see it, then we can open it up, and that improves your urinary your symptoms and prevents urinary tract infections. So in females, also a vaginal exam is important, a bimanual vaginal exam. And there we check for vaginal issues that could cause urinary tract infections like atrophic vaginitis and or GYN cancers, malignancies, or masses that could push on the urethra and again constrain that urethra so that it's not wide open, but it's closed. And the whole goal is to make the urine flow.
So I guess for men, what are some things, how can we determine, especially those of us that are getting older, how can we determine the difference between what might just be a common urinary tract infection or something that's easily treatable and something that's more serious like prostate cancer? Like, are there some physical symptoms that we should look for, or should we just be getting our regular checkups to make sure that we don't have any issues?
No, I think that the regular checkups, are important because in the regular checkups, we are dotting I's and crossing T's on the causes of the symptoms that you have. If prostate cancer is a cause for the symptoms that you have, and you have other risk factors for prostate cancer, then we would look into that. That's important, especially if you know that you have a family history of prostate cancer and you're starting to have urinary symptoms. That is going to be a part of your workup diagnostically. Likewise, for women, disproportionately, women are diagnosed with bladder cancer at a later stage and less commonly diagnosed. And so this is because the fact that women get urinary tract infections too common, right? Mm-hmm. So a lot of times when they have these symptoms, we'll chalk it up to the fact that, hey, she just has a urinary tract infection, give her some antibiotics. And the workup isn't complete. So that's another issue where getting a diagnostic cystoscopy and receiving the complete workup for your recurrent urinary tract infections is critical in diagnosing cancer.
So, so Dr. LeNoir, this kind of reminds us when we had Dr. Glenda on a couple of weeks ago about being your own best health advocate. You have to know your family history in terms of your status, in terms of, is there a cancer history in your family? You have to know what your baselines are, and you have to know what questions to ask your doctor in terms of being able to say, okay, was that a complete workup, or are you just kind of stopping short and saying it's a UTI, especially for women, and it could be something more serious like bladder cancer. And so make sure in terms of being your own best health advocate, know what questions to ask, know what you're looking for in terms of your workup, and knowing your family history go a long way into making sure you're getting the right diagnosis and treatment. So just wanted to throw that in there because I know we got the books and everything. We want to make sure that we're getting robust. We're getting some great information, and the comments are loving you, Dr. Langford, the information that you're providing, because you're helping people be better when they go in to see their doctors.
Dr. Langford is our guest. He's a urologist, practices in Oakland, California. This is the African American Wellness Watch, sponsored by BlackDoctor.org and the African American Wellness Project. We still have a few more minutes, so if you've got questions, get in the chat room. We'll try to get to them. We have a couple of questions. One is that one of our questioners wants to know, every time she sneezes, she pees. Does that mean you have urinary tract infection? Another question is, does blood in the urine, in the absence of maybe menstrual periods, is that a significant symptom of urinary tract infection, or does that mean you have to go a little bit deeper? So those are two questions that are still out there.
Oh, those are great questions. First, I'll look at the sneezing when you urinate. So there's something called stress urinary incontinence. Incontinence means when you leak urine, when you don't want to. And when you have a stress, a cough, a sneeze, if you're bearing down to pick up something heavy, those will cause, when women get leakage or men get leakage at that point, we call that stress urinary incontinence. Okay. A lot of times the cause of stress urinary incontinence is multifactorial. There's a lot of different causes, but one of the causes for women is the urethra is really mobile. And this happens over time, hypermobility of the urethra. And so the treatments can be behavioral modification, where we would ask that she hold her urine and try to bear down and do a Kegel exercise. A Kegel exercise is basically trying to stop your urine midstream while you're urinating. That's a Kegel exercise. If you can do that, you got strong Kegels for men and women. If behavioral modification, i.e. changing the way you drink, changing the way, we're going to look at the constipation, we're going to tell you to do Kegel exercises. Then we talk about medications. Some of the medications that help us prevent stress urinary incontinence is increasing our bladder capacity. Increasing our bladder capacity with certain medications helps the bladder hold more urine so that it's not so small and causing more pressure and loss of urine when you move, sneeze, or cough. So those are some of the strategies involved in treating stress urinary incontinence. Last but not least, and at the end of the line is surgery. A lot of physicians will jump to surgery first because it's very successful in stopping the leakage. But I think that going down the line and really giving the patient the opportunity to change their life and change their behavior to help them live better instead of doing surgery first, on the first shot is always my motto. And the surgeries for stress urinary incontinence all revolve around trying to fix that urethra so it doesn't move as much. Those are called sling procedures.
And the blood in the urine.
Oh,
yeah. Go ahead.
So blood in the urine, is it? You have something to say, Dr. LeNoir?
No, I'm just asking.
Yeah. So blood in the urine is an important topic. Commonly, you will be sent to your urologist when they find blood in your urine. Now, blood in your urine can be associated with an infection, and we call that cystitis or urinary tract infection with blood in the urine, or it can be associated without an infection at all. Okay. If it's not associated and it's not associated with vaginal bleeding, which is something to definitely distinguish, because a lot of times when women are on their period, when they're having vaginal flow, when they're having their menses, they may think that they have blood in the urine. And so we always repeat the urine study after they finish their menses. So blood in the urine, absent of a urinary tract infection and absent of a menses, can mean that there's bleeding anywhere in the urinary tract. The most common cause for blood in the urine, except urinary tract infection, if you exclude urinary tract infections, urinary stones, or atrophic vaginitis. But it also can be caused by cancer. And so that's why blood in the urine necessitates a diagnostic workup, vaginal exam, and imaging studies of the kidneys.
We got a question from Anthony about, he's a paraplegic with neurogenic bladder. He wants to know how he can prevent urinary tract infections. He self-casts 5 to 6 times a day, and he's been told cranberry juice is good, but he has not had good results.
Well, we dispelled the cranberry juice myth earlier in the program.
Well,
I'm so sad about that. I got to go dump some buckets of cranberry juice. I have in my refrigerator now. But yeah, so is cathing, is using a catheter helping? What can he do? What can Anthony do?
No. I think, it's very common for people who lose function to their bladder. We call this collectively neurogenic bladder, or when the bladder doesn't work and you don't pee normally. If you're sitting in a wheelchair, the urine is static. And so that's why self-cathing to make the urine flow is one of the ways that we sort of try to prevent the urinary tract infection and prevent stasis of urine. Also, prevent the urine from just retaining. And it looks like he's up to 5 to 6 times per day, which is usually about Q4 hours, every 4 hours, which is quite, I mean, it's quite time consuming and quite laborious. And then next, it looks like he's been doing some cranberry juice. I would start off by saying that one of the things I would really look at, and this happens with paraplegics and quadriplegics, is constipation. I would get really serious about avoiding constipation any way possible, or having a similar regimen to caring about my urinary tract infections with the cranberry juice to caring about my bowel movements with Miralax. That's a popular one that I tell. You can just, it's a powder. You can add it to your water, your coffee, your juice, your tea, and do that daily. Second, I would discuss possibly moving on from cathing 5 to 6 times per day. Sometimes cathing 5 or 6 times per day can give trauma. You can cause trauma to the urethra because every time you go through there, it's another opportunity for you to hit the side of the urethra or injure part of the urethra. So there may be a need to move on to a suprapubic tube, and that's a tube that goes directly into the bladder. But short of that, if we just want to focus on what you could do, short of doing any invasive procedures, I would say a strict bowel regimen. I would say that I would add in D-mannose to your daily regimen with the cranberry juice, and I would drink or increase your fluid to at least 2.5 liters per day.
One of the things that always has puzzled me is many of my friends who have had, bladder cancer. It was found as an incidental finding when looking for other symptoms in the urinary tract. George has a question about how frequent is bladder cancer, and are there any symptoms that you can point to that might make people suspicious of that?
I'm sorry, I didn't get the last part of the question.
Are there any symptoms that people can look to that might indicate bladder cancer?
So bladder cancer it's common if you have urologic issues, but it's uncommon in general. It's less common than prostate cancer. Prostate cancer is very common, but bladder cancer is less common than prostate cancer. However, it is a concern if you have many lower urinary tract symptoms. Now, the symptoms for, I think there's risk factors that we should focus on for bladder cancer instead of symptoms. And those risk factors are if you smoke. If you're a smoker, you probably have a higher risk of bladder cancer as well as kidney cancer and lung cancer, of course. And blood in your urine. Smoking and blood in your urine, or either of those two, will put you at risk for a workup for bladder cancer. Now, when you have blood in your urine, that is a part of the workup. If you reported to your doctor that you have blood in your urine, they would send you to a urologist, or they should send you to a urologist to be evaluated for cancer as one of the causes for the blood in urine. And I think that's an important symptom to look at. And if you've had blood in your urine, you should ask your doctor, have I been evaluated for bladder cancer? That is the most critical symptom.
Carmen has a contribution. Carmen Blakely Adams, Bennett fibers, good to increase fruits and vegetables and whole grains to reduce constipation. She wanted to mention that. What we haven't talked about are the specific medicines that you use to treat urinary tract infection. What should people expect once they get the diagnosis? What kinds of antibiotics? What are some of the choices? What are some of the side effects?
Yeah, that's a good question. So every city, every hospital has a diagram of bacteria, or has a biogram. It's a diagram of the antibiotics that have high resistance in the community, and it has the antibiotics that are good in the community. So I would suggest that that is an important place to start. You want to know your community, what bacteria are resistant in your community and what aren't resistant. I want to talk about this antibiotic first, because this was an antibiotic that was commonly used in the past. It's called ciprofloxacin. It's a fluoroquinolone. That's the type of antibiotic. There's a number of names, Cipro. There's also Levaquin. These are all the same antibiotic, the oral medication. It used to be used as a first-line therapy for urinary tract infections because of the way it concentrates in the urine. However, there's a recent, within the last 5 to 10 years, black box warning, which added on a lot of different side effects of the medication, some of which I've never experienced in practice, but they're quite severe. Neurologic symptoms that they would say that there's side effects, neurologic side effects. One of the side effects that was very common is a rupture of the Achilles tendon or tendon issues. And of course, these antibiotics can be quite harmful to your kidneys. So that one, I think, is less common, but it was not really found. I think it was used for many years very safely, without issue. But more recently, it's less commonly used, and there has been a surgence of bacteria, E. coli resistant to fluoroquinolones, which also sort of led to the less use.
E. coli, E. coli being the most common form of bacterial infection.
Yes, E. coli would be the most common bacteria that infects the urinary tract. One of the antibiotics that we use commonly is Bactrim. Bactrim is an antibiotic that concentrates well into the urinary system. It's a sulfa antibiotic. A lot of people are allergic to sulfa medications, so that's something to think about. Some of the major side effects of Bactrim would be just mainly it can be harmful to the kidneys. So if you have poor renal function, Bactrim could be bad for you. But one of the most common used medications is nitrofurantoin or macrobid. Macrobid is a bacteriostatic antibiotic. It's not bactericidal, meaning it doesn't kill bacteria as well as the others. It more so limits their growth. And I use that a lot, actually, because it can sufficiently limit the growth of the bacteria in order for your body to take over and pretty much treat the infection. As some individuals have more subclinical infections as well, so the macrobid is a good option for that.
Well, Dr. Langford, when we started to talk about this, I thought bacterial infections wouldn't be enough of a topic, but we kept you over and we put you to work. So we want to thank you for joining us. You'll be back.
Yes.
Talk to us many times about different aspects of urologic disease. So I'd certainly like to thank you. I'd like to give thanks to Mignon LeNoir, who put together some of this process. Of course, Mr. Dean, who shepherds us through everything as part of this. But most of all, I'd like to thank those of you who joined us. Remember that we're on every week from 6 to 7 Pacific Standard Time, 9 to 10 Eastern Standard Time. And even if you have additional questions, Dr. Langford will be featured on our podcast in the very near future. Our last podcast was on racism in medicine, conversation between myself and Mr. Dean. So blackdoctor.org, the African American Wellness Project, awellnessproject.org. And we have on our website a program for any disease that you have. We can get you information that's true with blackdoctors.org. So remember, health is your biggest asset. So protect it. Back to Mr. Dean.
Thank you, brother.